Hey there, my name is Caleb Confusione. I am a senior at Florida State University studying biological sciences. I'm here today to talk about a STEM topic that I find very interesting and that I'm very passionate about. It is called PRP therapy or treatment, otherwise known as platelet-rich plasma treatment. So here we go.
It's just part of your plasma that's really concentrated in platelets.
Also contains healing growth factors and alpha granules that promote this healing response in your body as well.
Within the orthopedic literature, the evidence is growing in support of this type of treatment, but it's not definitive by any stroke of imagination.
It's not conclusive yet, but like you said, it is growing evidence that this does have some promise and some potential.
So what is PRP? PRP is platelet-rich plasma. So what is plasma and what are platelets? So plasma is the portion of the blood that is largely liquid. It contains many proteins and lots of water, and it also has room for white blood cells, red blood cells, and platelets. So platelets are basically just another kind of blood cell that function in causing blood clots and also in stimulating healing processes in the body. So the platelet function that we are specifically interested in is helping stimulate regrowth. In order to take advantage of these valuable growth factors, physicians must first retrieve them and then isolate them. So how does PRP work functionally in a doctor's office? So the physician will first start by taking just a basic blood draw from the patient. Once they've obtained the blood sample that they need, they'll then centrifuge that blood so that they can separate the blood into layers of platelet-poor plasma and platelet-rich plasma, which they will then use in the next step. Once the doctor has the PRP injection in a syringe ready to go, they can then inject the injured area of the patient, whether that be a shoulder, elbow, or even a knee. These PRP injections do quite well with any kind of ligament or tissue damage. In this animation, we can clearly see the process of PRP as blood is drawn out from the patient and now spun in a centrifuge so that we can separate the blood into layers of platelet-poor plasma and platelet-rich plasma. Now this sample is injected back into the patient's affected area so that the growth factors can stimulate a healing process. Once these platelets and growth factors are introduced to the affected area, they then catalyze a cascade of reactions between other proteins to help stimulate the healing process. The patient may experience some significant pain during the first week after treatment, but it could reduce healing time from 6 weeks all the way down to 3 weeks, which for professional athletes means getting 3 games that they can play back onto the schedule. This past semester, I've been observing doctors work at Tallahassee Orthopedic Clinic, which is a sports medicine clinic that serves the Tallahassee community. I've seen PRP performed a few times now, both on older people and younger athletes, and the results have been extraordinary. In older patients, PRP has been shown to significantly reduce arthritic pain. For the younger patients, especially athletes, one of the main benefits of PRP is that it has a shorter recovery time than a fully invasive surgery. For the elderly person, this may mean that they can get back in the yard playing with their grandkids, and for a younger athlete, this might mean that they can get back on the field much sooner than expected. I hope that one day I too can administer PRP treatment to patients as an orthopedic physician, and I would really love just to get people's quality of life back in a quicker and more efficient way through PRP.